pad of the foot on your forearm. Okay? So the knee is where we're going to get control on this. So you put the other hand under the knee, so it's kind of like middle finger under the knee, and you buckle the knee passively, and you bring it up and hand to the side, and you basically guide it up with the foot, but you keep control through the foot. Okay? And it's very simple. We have flexion, passive, we have extension. You want to come right under it and guide it. Through extension, you're not going to get hyperextension. We just go to extension from the flexive position. Okay? And that's really all we've got to be worried about, plus internal, external rotation. So bringing it up to 90 degrees, up to here, internal, external rotation. Very simple. Quality movement, and then we can circumduct the hip, external circumduction, internal circumduction, using the hand like a rollie and keeping control of the foot. Okay, you can get a bit more with this down here if required. Okay, but bear in mind, if somebody is older, or even like me, I have arthritis in the right hip. Another one, I have arthritis in the right hip. Okay, and with FAI, okay, so if FAI, what you'd expect usually with arthritic type restrictions is a hard end range on any joint that has an arthritic restriction, especially in hips, passively up to here, and then you turn your rotate, they'll go out, and it'll stop dead range. Or it could be on here. FEI is actually normally on the external, as you said earlier, on the external rotation as you're coming up through here, as it kind of just catches as it's going out, maybe a clippy clunk. Okay, so it's quality of movement, and we're looking for this nice soft end range, because even if it hits an end range, this applies to all the joints. If you're hitting an end range and it's soft end range, you're looking at muscular restriction. But if it is a hard doorstop, it's usually a joint bony landmark that's causing the problem. So you're looking for all the quality of the movement on the movement. So we have our flexion, we have our extension, bringing it back up to flexion, we have our external rotation, our internal rotation, circumduction passively outwards, circumduction naturally inwards.
You're putting a fair amount of pressure on there, are you?
Yeah, because you need to move it passively. It's the same with all the joints. If you're suspecting if you're just assessing the joint quality, then you'll get away with it. But if they're in pain, you won't get away with that.
Yeah.
I mean, you barely get it off the table. Like, you'd be very cautious. You know, are you okay there? Did I go dead? Are you okay? Is everything all right? Any pain there? Okay, just let me know if you're sore. And then you'd be very, very cautious with it moving along. They'll be jittering because there's pain there. And they say, where is that sore? Can you just put your finger when I'm moving it around where it's sore? You know, it could be an outer, it could be on the inner, and then they'll put their finger exactly where the pain is.